Well, it's just not about looking good, but it's also about feeling good, staying healthy, and preventing serious health issues. I've been hearing of Bangalore's top weight loss surgeons, Dr. Moinoddin. He's a leading expert in weight loss surgeries and metabolic health, helping so many people transform their lives. And of course, I have so many questions, and I know all of you do too. So stay tuned as I sit down with him to talk about how bariatric surgery works, who it's for, and how it's actually changing lives. If you've ever struggled with weight and wondered about medical options, don't miss this. Hello, doctor. How are you?
Hi, Sakshi.
Good to see you. And a lot of us have a lot of questions regarding obesity. So we would like to know your 2 cents of advice and all your thoughts on the same topic. So my first question to you is, why do you think obesity is increasing so much in India, especially when it comes to young adults?
Yeah. So basically, we are adapting to Western habits. Before we used to eat rice, dal, sambar, whatever it is. Now we are going directly burgers, pizza, and ready-made things and stuffed food, refined oils, and all. And within a click, we are getting delivered food delivered. Before we have to go cook the food and bring back. So in that way, and they're really not conscious that whatever we are eating, we have to burn it out. The fitness concept is not there. Only fitness concept is only for the people who are in film industry like you or models and all. Rest they think it's not for us. That's one of the reasons.
Okay. So, doctor, I heard that there are a lot of young women that are coming to you for obesity-related issues.
Yeah.
Do you think that specifically women are fighting and battling obesity compared to men, or what are your thoughts on
Yeah.
it?
So if you really see the percentage wise, I can see 50, more than 50% women come to us. Like the men percentage is slightly lesser than the women. In men, the androgen doesn't control much weight. But women, they have a lot of hormonal estrogen, progesterone controls the weight. If you really see, they have PCOD issues, because there is abnormality in the hormones, which will make them gain weight without their knowledge. Okay. There is one more thing called hypothyroidism. Both the things will slow their metabolism. Slow, even though you are not eating anything, they start gaining. So you see this trend very common nowadays. That young women are coming for this OPD, and the issue can be many things. That can be a cosmetic issue. There can be one more issue like infertility issue. They got married but they are not conceiving. Those kind of patients also comes to us.
Okay, so do you think like because of weight gain, all these issues are happening to them, and
Yes,
that can
yes.
be sorted with the surgeries?
Yeah. See, what happens is young women who comes to us, they would have tried in everything, A to Z diets, they would have tried workouts, they would have tried, they would have tried intermittent fasting, they would have tried all the paleo, Mediterranean, keto, whatever possible, diets, tablets, everything. Definitely what happens is those, whatever medication they take, they temporarily lose weight, but they come back again. Because the problem is you are doing some manipulation with your body. You're trying the body to lose its weight forcibly. So which just doesn't happen. So those kind of patients, they can definitely opt if they qualify the criteria. Not everyone who come to us, we do surgery.
So can you like specify what would be the criteria in detail for our audience to understand?
So there is a criteria called BMI, body mass index. The body mass index should be less than 25, usually for normal people. More than 30, obesity we call it as. So 32.5 BMI plus qualifies for the surgery.
Okay. That is irrespective of their age, irrespective of their height.
Irrespective of their age. We consider usually the body mass index after 16 years.
Okay.
Kids, we don't consider this thing.
So, doctor, what weight loss options are available for people who are probably, say, above 100 kgs?
Yeah. See, once you cross 100 kgs, the options are very limited. The thing here is, as you grow more than 100 kgs, it means your body has tried enough things to lose weight.
Okay.
Your body has tried and time and tested, they have tried to lose enough body weight. So what happens is your body will go into a fat set point higher resolution. By doing this repeated weight loss things and all, what will happen? You are pushing the fat set point to further higher.
Can you throw some more light on what this fat set point is like?
So fat set point is very clear. Every body has one particular weight to withstand. So what happens is when you are, for example, you are taking any steroid tablets, the fat set point goes a little higher. So what happens is you start gaining weight. Whenever the fat set point goes high, it means that your metabolism is going down. Whenever the metabolism goes down, even though you don't eat, you gain weight. That's how it works. So if you really see, fat set point is inversely proportional to metabolic rate.
Yes.
So what happens with this is, the higher the fat set point. Fat set point means basically you are lowering the metabolism. The other thing, what happens is, even these hormonal changes can affect the metabolic rate, like PCOD, hypothyroid. It slows down the metabolic rate. External medication can reduce it, and stress also will reduce the metabolism. And sleep, lack of sleep. You should sleep at least 6 to 8 hours.
So, doctor, how is diabetes and weight loss connected? And does weight loss surgery really help people with diabetes?
Yeah. So diabetes and obesity are almost very much closely related. That's the reason we termed a word called diabesity.
Okay.
Diabetes plus obesity is diabesity. So what happens when you're obese? The chance of getting diabetes is very common. And if you really see nowadays the modern trend, diabetes is almost in obese patients, 80% are going into diabetes. That is one thing. So, but diabetes, what happens in obese patients? The diabetes levels, the sugar levels becomes very deranged.
Okay.
So as you become more and more obese, the sugar level becomes haywire. It goes very high, 400, 500 and those. So the reason here is insulin resistance. When you take sugar, the pancreas produces insulin, that will control your sugar because the tissue is absorbing. In obese patients, they stop absorbing. They become resistant to the insulin. That is called insulin resistance. So what happens is, those kind of diabetes patients comes to us who are morbidly obese. We give them surgery as a first option. The reason is, once we start doing the surgery, the same day the surgery starts acting. So within a week or 10, most of the times we reduce the medication or we stop many of the times. 95% of the times we stop. 5% of the times we may reduce the dose. It depends on the intensity of diabetes and depends on the duration of diabetes. So losing weight definitely helps in diabetes.
Right. So you're saying that after the surgery, the patients can actually stop their diabetic medication?
Yes, definitely this is a kind of diabetic surgery. Once we do surgery, whatever the insulin produced starts getting absorbed. Insulin resistance gets better. So we don't need to supplement from outside any insulin. That's how we stop the medicines.
Okay.
So most, I think, like 90 to 95% we stop the medicine for diabetes.
In how much time, doctor, generally does the results start showing up for someone who goes to the surgery?
Start from day one.
Okay.
The next day itself, the dose will come down.
Okay.
I do a surgery today, for example, 12 o'clock I've done surgery. The next day itself, the dose will come down significantly.
Okay.
While discharge, most of the time I discharge the patient next day.
Okay.
So what happens? I reduce the dose to almost half or very significantly. Then I monitor over a period of time. I'll see that if it is really required, we'll give the medicine dose. Otherwise, we'll tamper it and slowly stop it.
Okay. And what are the side effects for people specifically with diabetes going through the surgery?
Nothing. People think diabetes, the wound healing will be hampered. It is a keyhole surgery. It is not a cutting surgery. So it's a keyhole surgery, hardly any difference in wound healing. So people who come, many of them, they come at 400, 500 sugars. Definitely, they do very well.
And doctor, in your experience of doing this weight loss surgery, like what has been the success rate?
Yeah. So success rate, what happens is, to be very frank, the technology has very much evolved over 10 to 15 years. The stapler technology, the hospital, the infrastructure, especially Manipal Miller Road, we have 4K camera. So the vision and everything has gotten better. So the complication we don't discuss much about nowadays. Before it was around 2%, now it has come down to 1%. I hope slowly it goes down further down. We hardly see any complications nowadays because the reason is the protocols are very well set. Manipal Miller Road, we do highest here.
Okay.
Good number of surgeries we do. Yeah.
So, doctor, can you throw some light on what the hospitalization process looks like, and also like what are the lifestyle changes that patients need to go through just to make sure that they maintain the after effects of the surgery?
Yeah. See, what happens in the hospitalization is not much because it's a keyhole surgery. The surgery takes only 45 minutes. Within 2 hours, we'll make them walk. The patient will be walking within 2 hours. Every 1 hour, the patient walks. Next day, once they're good to go, we discharge them. So within a week, they can be back to the normal activities. Like whatever they're doing, they can do it. And basically, the diet changes will be there. Initially, liquid diet, then semi-soft, then normal food and all. But some amount of maintenance is required from patient side also. Like I regularly suggest to treadmill, half an hour to 45 minutes, because the reason is normal walking, whatever you do, the metabolism will not pick it up.
Right.
Treadmill, when you do the metabolism picks up.
Right.
See, if your knees are good, you can do an inclination.
Right.
If your knees are not good, I don't suggest them. So in that way, treadmill is really good. For people who are 50, 60, at least they can do simple walk.
Okay.
So in that way, they maintain and they should be out of sugars for the life. Whatever sugars, they should be out of sugars.
And that 1 week you said, no, doctor, like they have to take care of themselves the moment they leave the hospital. Can you throw some light? What should their lifestyle be like?
So what happens initially, the liquid diet you give. Then after a week, full liquids, thick liquids you give. After 15 days, you put it on semi-soft. Usually, you might get type of food, oats and all, pureed kind of diet. Then after a month, you can be eating whatever you are eating, but some restrictions on the foods like sugars and Coke, Pepsi, and alcohol, smoking. This kind of changes they have to maintain. And what happens is, as they lose weight, their mobility increases. Before they're unable to walk for a short distance. Now, as they lose weight, they become lighter and they can walk little more than that.
Right. So, doctor, another question that I have is, if someone is having like back issues or some knee issues, because I have people in my family who face that, too much of activity is not happening.
Yeah.
So, what happens post-surgery for some patient like that category?
Yeah. So, definitely, surgery is definitely going to help them, but they may not lose that much weight as like other people who are very active. For example, if the target is 40 kgs, they have to lose. They may not lose 40, but they may lose 25, 30. That still helps them. Okay? And they can postpone their knee replacements. Yeah.
So, doctor, can you throw some light on what exactly happens in this weight loss surgery? Because the word sounds very complicated. People are very scared to even think about it. So, yes, it would be really nice if you give us that safe zone.
See, people think liposuction is weight loss. Liposuction is a cosmetic surgery. Let's not discuss about it. Liposuction is a different entity. Weight loss surgery is a different entity. What I'm doing is weight loss surgery. It's a bariatric and metabolic surgery. What I do is I put a small keyholes on your tummy. Small, maybe 1 centimeter holes on your tummy. We put the camera inside. By seeing in the monitor, we operate.
Okay.
It's not a cutting surgery.
Okay.
It's a keyhole.
Okay.
So we don't remove any stitches. The surgery takes only 45 minutes. What basically I do is we reduce the size of your stomach. So stomach means stomach bag. You will be eating, for example, this much. You will come down to 15 to 20%. But instead of eating 3 times, you can eat 4 to 5 times. The quantity reduction. Number 2, we join with the intestine. We bypass few part of the stomach. So what happens? The food will go into smaller part of the stomach, bypass some part of the stomach and intestine, go into the small intestine. So it's basically a bypass route. Before you have to eat this much to satisfy your brain and stomach. Now, if you eat this much also, you get happy. That is one thing. Number 2, the metabolism increases. As I said, the metabolic rate drastically increases. So what happens? It burns your fat wherever it is. It will melt the fat. And it comes to the stool route. That's how you're going to lose the weight. Definitely the quality of life will be far better. They'll thank us for that.
Right.
They'll regret not doing it earlier.
So if somebody wants to just have a cutoff on the amount of weight they want to lose, say that they want to lose only 20 kgs, they don't want to lose 40 kgs. Then how does it work?
Now what I can do is at least we can do less bypass limb.
So there is a way to do that.
And maybe the stomach we can make little loose. Instead of 20%, we can make them eat little more.
Okay.
Those kind of things we can do it.
Okay. And what about girls with PCOD? Does this surgery really help reversing that also?
Yes. PCOD reversal is very, very common with weight loss itself. Any kind of weight loss. You do any kind of weight loss, PCOD reversal happens. So what happens is once you lose weight, 40, 30 kgs they lose. So definitely the menses becomes regular. What my observation is, within 3 months, the menses comes on a track.
So doctor, does health insurance cover weight loss surgery?
Yes, definitely. From last 4 years, I can see the insurance coverage is better.
Okay.
So if you see, the insurance coverages depends on your individual insurance. For example, you have taken a personal insurance or corporate insurance. Corporate insurance, the chances are very high. Individual insurance also depends on terms and conditions.
So finally, doctor, for our audience, we would like to know what's your advice on anyone who's considering weight loss surgery?
Yeah. See, weight loss is something which is going to transform your life and it is going to improve the quality of life. Definitely don't think weight loss is just making you look better. That's one of the things. But if you really see, many people who are obese are depressed because they are unable to see themselves in the mirror or social stigma. And the jokes, wherever they start, they end on these obese people. We suggest them to walk post-surgery. Definitely the serotonins are releasing, endorphins are releasing, exercise and all post-surgery, definitely the happy hormones are going to increase and they will become mentally also better. That's one thing. And physically, definitely you are going to lose weight. And the number 3 here is the health issues get better. Your diabetes gets better, your blood pressure gets better, your breathing difficulty gets better. And sleep apnea, that is one condition we are not discussed with. The sleep apnea, snoring in the night gets better. The snoring goes off.
Okay.
Within a month, I think snoring goes off.
So you're saying that weight and snoring is connected?
Yeah, obviously.
Okay.
That is called obstructive sleep apnea.
Right.
Because fat is deposited in the upper airway tract, which will obstruct your air inflow.
Okay.
That's how you snore.
So what's your advice for anyone who wants to do this now?
See, I always feel you should select a correct person. Means correct surgeon. Correct surgeon, correct hospital with correct infrastructure. And you should inquire that this surgery is happening on the regular basis and then opt for it.
Right.
And don't blame the surgery by doing in the wrong places,
Right.
in the wrong hands.
Right.
So we are not guaranteeing for other people.
Right.
I can guarantee for myself and my hospital. So in that way, come in the correct hands for this surgery because it's a specialized surgery. It shouldn't be done anywhere just like that. It should be done in a specialized center. We at Manipal Miller definitely we are well equipped to do it. And we are doing it 200 plus kgs of very regular interval. So we have around 150 to 240. We have around 200 250 patients in those criteria. Very high numbers we do. So a lot of doctors we have done. Right. Definitely, it's going to give a new life. Okay. Thank you so much, Doctor. Thank you, Sakshi. It was really nice catching up and discussing such important issue that is really bothering young adults in our country. Not only young adults, even the elders. And I've got like a lot of good 2 cents of advice from you. So thanks a lot for your time. Thank you. So after a great chat with doctor and discussing all the lovely things that we discussed regarding weight loss surgery, my entire perception has changed because me myself being someone who's always been into fitness, diet and exercise, of course I feel that weight loss surgery was such a huge stigma even for me, and of course it's still a stigma for a lot of people. But as we discussed with doctor, I think that choosing your right doctor is very important, choosing the right hospital is very important, and especially for people who fitness and exercises is not really giving you the results. I think of course you can definitely consider this because I'm feeling very convinced about it. So maybe you guys should also definitely think about it. So for more insights and a deeper knowledge and to understand and watch testimonials, do follow Dr. Moinoddin's Instagram profile, that is Surgeon Flex.